Radio Nigeria, uplifting the people and uniting the nation.
Nutrition plays a key role in the realization of the Millennium Development Goals, while nutritional deficiencies contribute to the high rate of disability, mortality and morbidity in Africa. According to available data, at least 41% of African children under 5 suffer stunted growth as a result of malnutrition. Against the background of the ongoing Conference of African Ministers of Finance, with a side event which will focus on child stunting and its implications for social and economic development of Africa, we have in the studio the Chief Executive Officer of Save the Children International, Jasmine Whitbread, to talk to us on the issue. You're welcome to our studios.
Thank you.
So let's begin. I mean, there is a Conference of African Ministers of Finance, and then this is on the sidelines, talking about child stunting and its implications for socioeconomic development. Give us some highlights.
So the African Union has just released a report on that they've called the cost of hunger, that really looks into not just the social implications but also the economic impact of this huge number of children who are growing up either mentally or physically and certainly emotionally stunted because they're not getting the right nutrients at an early age. And it's really quite striking, the results of that report. So somebody who was stunted before the age of 2 and didn't recover is likely to earn 20% less in their life. And if you look at what that means for a nation across the whole of the GDP, estimates are that that can be as much as 20% of GDP is lost if a nation has a large percentage of children growing up stunted. And in Nigeria, which has been a growth powerhouse really in terms of its GDP growth, the estimates are that 37% of children in Nigeria are suffering from malnutrition.
So what is the challenge for us? Because is it a challenge of food? Is it a challenge of not getting the right mix? I mean, what is it?
You're exactly right in your question, because it's not actually about quantity of food. And often when there are discussions around agriculture, I noticed you had a news story earlier talking about rice, that agriculture is looked at as a developmental or it should be looked at as a developmental issue and a nutritional issue rather than just a market issue. So Nigeria is agriculturally a very rich country. You grow all the right crops, not to mention the fact that actually the best food that you can give a child before the age of 6 months is their own mother's breast milk. So it's not a complicated solution in terms of the right nutrition to stop people becoming suffering from malnutrition or being stunted, but it's a question of really kind of looking at this through lots of different lenses, whether it's agriculture or health or education.
What has come to my mind is that we have quite a number of child survival programs. I mean, let's look at some of them. We have maternal and child health program. We have the Save 1 Million Lives initiative. Recently, our polio coverage hit over 80%. So is it that we're not doing enough, or we don't just have the right policies? What can we do to get it right?
So it's a bit of both, I'm afraid. But you're right, there has been a lot of progress, and it's fantastic, for example, that the Nigerian government has signed up to be part of the Scaling Up Nutrition global program, but that still has to be launched here in Nigeria. But if you look at, in terms of enough, the estimate in terms of how much is spent on health in Nigeria per person is just under $20 per person. But the Nigerian government themselves have signed up in the Every Woman, Every Child commitment at a global level. That needs to be, by their own estimates, just over $30 per person. So there's not enough being done. In terms of are they the right things, as we said earlier, it's good to see that there is a focus on under 5s, the Every Woman, Every Child program. But I was with Market Women yesterday, some of our program partners here in Nigeria, and they were really so strongly vocal about the need to focus more on and really deliver. It's all very well making these announcements, but they've got to be followed through into delivery. They were talking about what the sorts of troubles that they go through when they fall pregnant, in terms of finding a clinic, getting to the clinic. When they get there, are the staff available? Are the drugs available? Real horror stories in terms of what they've gone through, children that they've lost. and the suffering that they've gone through as women themselves. As you know, maternal mortality is also an issue here in Nigeria.
So in other words...
So there is much more that needs to be done in terms of actually delivering on the ground, particularly to some of the poorest and most marginalised parts of Nigeria.
So we must match words with action. Before you go, so what is your organisation doing to tackle child nutrition in Africa and, of course, Nigeria?
So here in Nigeria, I'm really coming to see the work of our fantastic team on the ground here, Save the Children, and their work with partners. And we work in 16 states across a number of programs, reaching about 5 million mothers and children across a range of health and nutrition programs. And we do similar in other countries around the world. I've visited many of them. And it's always encouraging to see what local people are able to do with a little bit of support from outside agencies like Save the Children.
Okay. I wish we could talk more. I wish we had more time. But I must say thank you so much for coming. And I'm sure we'll get you again to talk more to us about nutrition, especially with the child. You've been listening to Jasmine Whitbread. She is Chief Executive Officer of Save the Children International. Many thanks for being here.
Thank you very much.
Thank you.